All right, let's get right into it. In the world of emergency medicine, some of the most critical information you'll ever get about a patient comes in the first few seconds, often before anyone's even said a single word. This is what we call the silent assessment, and honestly, understanding it is a total game changer.
So, picture this. You're a first responder. You're just arriving on a scene. The moment you step out of that ambulance, your brain is already working. Your eyes are scanning, and you're gathering absolutely critical data. And that whole experience brings us to a central question that every EMT and paramedic has to answer, like instantly.
So here's the question for you. Put yourself in those boots for a second. Which of these can you figure out without even talking to a patient? Is it their affect, their memory, their thought, or their orientation? Go ahead, take a moment. What can you learn just by looking?
To figure this one out, let's do what any good provider would do. Use a process of elimination. As it turns out, 3 of these options absolutely 100% require you to have a conversation. Let's break down exactly why that is.
Okay, first up, memory. This one's kind of obvious when you stop and think about it, right? To have any idea if someone remembers what happened, or even simple stuff like what they had for breakfast, you've got to ask them. You're testing their recall, and that just doesn't work without direct questions.
Next, let's talk about thought. How in the world can you know what's going on inside someone's head? Well, you have to listen to them talk. You're checking to see if their thoughts are coherent, if they're making logical sense, and if what they're saying is, based in reality. It's all about their verbal output.
And finally, we've got orientation. This is the classic, right? The do you know who you are, where you are, and what year it is kind of questions. By its very definition, checking a patient's orientation to person, place, time, and the situation, well, it's a conversation. You just can't assess it by looking.
So, if we've taken memory, thought, and orientation off the table, we're left with our answer, a patient's affect. And this is where a responder's sharp eye becomes one of their most powerful tools, all before the formal questions even begin.
Yep, it's the single most important piece of the puzzle you can get just from watching. But the real question is, what exactly are you watching for?
The answer is affect. So what is affect? Simply put, it's the outward physical expression of whatever is going on emotionally inside a person. Think of it like this. It's not what the person says they're feeling, but what their body and their face are showing you they're feeling. So what are these nonverbal signals? Well, you're looking at their facial expression. Is it pained? Is it happy? Is it totally blank? You're observing their body language. Are they tense, relaxed, agitated? You're even noticing if their emotional reaction seems to match how serious the situation is. All of these are absolutely vital clues.
And this visual check is also critical for your own safety. You're not just evaluating the patient's condition, you're evaluating the whole scene. Things like a raised tone of voice, someone talking so fast you can barely keep up, or clenched fists. Those are all red flags you can spot from across the room that tell you a situation could get dangerous fast.
Okay, so let's see how this all comes together, because this is way more than just an academic exercise. This skill, the ability to assess effect in a split second, gives first responders a massive advantage out in the field. It's all about turning pure observation into smart, immediate action.
So why does this matter so much? Because in just a few seconds, looking at a patient's affect gives you an instant read on their emotional stability, the risk of things escalating, and whether their response even makes sense for what's happening. This directly tells you how to approach the patient and whether you need to make some quick changes to keep everyone safe.
It really all comes down to this simple but incredibly powerful idea. That first impression, that gut feeling you get when you walk onto a scene, it often starts before a single word is spoken. The silent assessment is the foundation for everything that comes next. It makes you wonder, doesn't it? What other high-stakes professions rely this heavily on reading nonverbal cues to make life-or-death decisions?